Acknowledge. Thank you, Nadine. Apologies for that. You probably heard that interruption. So I just want to start with a bit of a land acknowledgement. So I'm joining today from the unceded and unsurrendered territories of the Algonquin and Anishinaabe people, colonially known as Ottawa, which is also where the offices of the Canadian Centre on Substance Use and Addiction are located. So we recognize that folks are joining from all different territories and places and spaces today. So please feel free to take a moment to kind of acknowledge where you're joining from. And now, pleased to sort of launch us into our content for today. So we're really pleased to have you join us for today's session, Health Canada's National Wastewater Drug Surveillance Initiative, helping Canadian cities respond to the drug crisis. So very excited to be introducing our speaker today, Samantha. Apologies for that, folks. I have lost my notes. So perhaps what we'll do is, I do apologize, Samantha, my notes have disappeared from my screen and, oh, here they are. Okay. So sorry, everyone. So would love to formally introduce Samantha Lancione, who joins us from Health Canada. She's a senior analyst with the Office of Drug Research Surveillance in Health Canada's Controlled Substances and Cannabis branch. With a background in epidemiology, she supports several high-profile initiatives addressing the drug crisis with a particular focus on data integration and stakeholder engagement. She leads the expansion of the National Wastewater Drug Surveillance Initiative and works closely with partners across all levels of government to advance collaborative, evidence-based surveillance efforts. And so she will be speaking more today about that National Wastewater Drug Surveillance Initiative. So I'm just going to stop sharing my screen so that Samantha's colleagues can share the content, and I will leave it with you, Samantha, to take us away.
Thank you so much, Chelsea, for that kind introduction. And as my colleague here just shares her screen, just wanted to say hello, and I'm very pleased to have the opportunity to come present to you and join you all today. So, as mentioned, my name is Samantha, and with that, I will jump right in. So, Health Canada is continuing to strengthen its surveillance activities to respond to the drug crisis, which continues to have profound impacts, as we know, on individuals, families, and communities across Canada. So, one of the initiatives supporting this work and the focus of today's discussion is our National Wastewater Drug Surveillance Initiative. So, our initiative analyzes wastewater samples that we collect nationally to screen for the presence of drugs and drug metabolites in Canada's wastewater. So, we really are focusing on looking at those new and emerging psychoactive substances and how the illegal drug supply may differ across Canada. And we really look to provide timely data on those new and emerging psychoactive substances back to our partners. We are really focusing on those unknown substances that may become substances of concern at a later time or have recently appeared on the illegal drug market. So, why is our wastewater surveillance initiative important? This is because it could provide us evidence to support policies, programs, and interventions at the community, regional, and federal levels. It can identify current trends and patterns of drugs of concern, as I mentioned, and wastewater is really what provides that unbiased insight into the types of drugs being used and that are circulating across different locations in Canada. Next slide, please. So, Health Canada is employing a qualitative approach to screen for these various substances, as I mentioned. So, the qualitative approach screens for the presence of drug metabolites, which occur when a drug is chemically modified by the body during or after use, as well as drugs in the sewer system, whether they be there by consumption or by other means, such as illegally dumping. So the approach, again, does not quantify the amount of a substance in the sample, but looks for the presence or absence of that substance. And next slide, please. So, with the ever evolving illegal drug market, it is important for us to be aware of as many new substances of concern as possible. So, what does this mean? So, taking this qualitative approach really enables Health Canada to screen for a much longer list of substances over compared to quantitative approach. So one of the main strengths of our program is that we are able to screen for the presence of over 550 psychoactive substances at a faster processing time and at a lower cost compared to other programs. This really allows our collaborators that work directly with us to get access to that high quality data in a timely manner. We are also able to conduct post hoc analyses with the qualitative data to identify new substances of concern at a later point. In addition, to reduce the burden for collaborators, Health Canada is also providing all sampling materials and covers associated shipping and analysis costs. Next slide, please. So here's what we would like to call our sample journey. This tracks the sample from collection to report generation. So just to kind of give an overview of what our process looks like, influent wastewater samples are collected by our collaborators and shipped twice per month to our facilities. Collection schedules can follow either two scenarios and depend on the capacity of our collaborators. So our gold standard is to collect samples 3 times per week and create a composite sample every 2 weeks to create that representative monthly sample, which then gets sent to our National Microbiology Laboratory for pre-processing and then to our Health Canada Drug Analysis Service laboratories, who analyzes the sample with mass spectrometry and uses this method to identify the presence of drugs and drug metabolites from our screening list. This information is then passed on to our team at the Office of Drug Research and Surveillance. So our chemistry team can identify the substance's control status and pharmacological classification of the substances identified in that substance. Once the data has been analyzed, we then send our data back to our collaborator in both with a analyzable data set as well as a report within 6 to 8 weeks. And finally, the data is included in 2 of our dashboards, the Canadian Drug and Substance Watch, and as well as the National Wastewater Drug Surveillance dashboard, where they are aggregated at the provincial and territorial level. And just a note here that individual sites are not identified. And next slide, please. So as I mentioned, the Canadian Drug and Substance Watch, or what we like to call Drug Watch for short, is our unique data-driven interactive surveillance platform that identifies new psychoactive substances as they appear on the illegal drug market in Canada. So this platform actually combines data from 3 different data sources. Wastewater is one of the key data sources that again provides that unbiased information into the types of drugs being used in different locations across Canada. And if you're interested, we can include the link for you to further explore the platform after the presentation. Next slide, please. So the wastewater data is also available, as I mentioned, through our recently launched National Wastewater Drug Surveillance Dashboard, which further promotes the transparency and accessibility of the data at Health Canada. So the dashboard provides a deeper understanding of the wastewater data and highlights the diversity of those 550 substances I was mentioning that are screened for. So here is also an example of the data that is available on the dashboard and what collaborators could expect to receive back from Health Canada on those customized reports for their specific communities. So you can see here that of the 219 distinct substances that we identified between 2023 and 2025, we identified 46 metabolites and 3 precursors. And as you can see here, and what we know from about the drug crisis in Canada, the majority of these substances that were identified were stimulants, opioids, and hallucinogens, which really matches what we understand of what is going on in the drug crisis. Next slide, please. So we have received a lot of interest in this surveillance approach, particularly given the fact that we can screen for such a large number of substances in a relatively short period of time, that there are also very little costs associated to our collaborators, and that we can leverage existing wastewater sample collections that are currently being done in a particular municipality or facility. So you can see here on the screen our current collaborators. So we're collaborating with other federal government departments, including Environments and Climate Change Canada, and the Public Health Agency of Canada. We are collaborating with different provincial, territorial governments, as well as many municipalities across the country, Indigenous communities, as well as academics. Next slide, please. So after our initial success, our goal is really to continue expanding this initiative so that it better reflects what's happening across the country. And we really pride ourselves on the fact that we are able to give data back to our collaborators in a meaningful way for their specific communities. So we are inviting any interested municipalities to express their interest in joining the initiative. And really, we want to stress that collaboration is central to this work. Municipalities really profit or gain access to that high quality, near real time data on the drug present in their water by facilitating and leveraging that existing wastewater sample collection at their treatment plants or facilities. So ultimately, our goal is to build a stronger evidence base to support timely interventions to address the drug crisis together. And with that, we have our final slide just with our email address that we can provide again at a later point uh, once we are finished with questions.
Thanks, Samantha. That was an awesome overview of the program and really kind of interesting to see the process you take and all like kind of the little parts that go into that. So we do have a couple of questions that have come through. So first question I want to talk about is just how many cities or jurisdictions have sample sites and what's sort of the demographics or overview? Are they big cities, small cities? Folks are curious to know who might be involved in this initiative.
Of course, that's a great question. So, unfortunately, we can't say specifically which cities are involved with us just because of privacy, but we do have a number of different types of cities. So, we work with both big cities, small cities, rural communities. As I mentioned, we are also collaborating with and working with Indigenous communities. So, really, we accept all kinds of municipalities that may be interested at this time. Currently, we are working with, I could say, over 30 different partners. So,
And similar to that, we had another question about, you know, would there be a way, because folks are like, I'm in Ontario and I don't know who's involved in this. So is there a way for a local community to know if they're already a part of this or who they would talk to about that if they were curious to know, if they worked in a unit and were curious about it?
they would probably have to go to their city council to ask if they are part of this initiative. Because as I mentioned, our public dashboards don't um, list the specific cities involved at this time. But you can always send us an email if you have any further questions about the data at the provincial or territorial level on the dashboards if you'd like to know a bit more.
Awesome. Okay, so it sounds like best place to go is going to be your local council. Maybe if you're involved in a unit or you're curious to know
Yes, and I should
if your region is involved,
yes, and I should mention that the
that
collaborators that we
would
work
probably
with. Oh, sorry, Chelsea, I'm not sure if it's
be
on my end.
your place.
Sorry, Chelsea, I'm not sure if it's on your end or on my end. Um, I will just mention that the collaborators that we work with and the data that we give back to the community is theirs to work with. So they're free to publish it in public health bulletins or release reports, um, as we don't own the data in that way. So there could be that their municipality is already participating and that future communications about their participation in the initiative can come at a later point.
Perfect. Thank you, Samantha. And it looks like Chelsea, unfortunately, is having some connectivity issues. So I'm just going to pick up where she's left off with a couple more questions as well. So we have another question around the types of substances that are being analyzed. So is there a way to differentiate between prescribed and illicit substances and their metabolites?
Yeah, so this is a great question. Because of the nature of the wastewater and the samples, we cannot differentiate between the illicit versus prescribed, the difference in that way. However, as I mentioned, we do screen for metabolites. So our chemistry team works extremely hard and is constantly updating our screening list. So just to give an idea, when the initiative first started, we were screening for over 400, and now we are close to 600 substances, or over 550, I should say. So it is constantly evolving and growing, but no, we cannot differentiate between prescribed and illicit, but we do screen for metabolites. So that, as I mentioned, is when the body chemically modifies the drug to be a confirmation of drug use.
Perfect. Thank you for that. This is fantastic. We're getting a number of questions, so I'm glad that we have lots of time to be able to cover the questions that are coming through from folks. So another question that we have is just in terms of the turnaround for the analysis. So how timely can the analysis be shared with participating municipalities?
Yeah, that's a great question. So right now, the monthly reports are sent back to our collaborators within 6 to 8 weeks, excuse me. And I should mention that our program is still, growing. And although we've been working on it very hard, it is still relatively new. So we're still trying to reduce that time as much as we can, hoping to get it shorter and shorter as the initiative grows and more collaborators come on board and build that internal capacity to really analyze those samples and get those reports out. But right now, it's a 6 to 8 week delay.
Okay, perfect. Thank you. And that's really helpful, I think, for folks that are on the call. Um, I have a question from someone who wants a little bit more detail to understand what the difference is between parent metabolite and precursor.
Oh, that's a great question, and I will try to answer in the best way that I can. So, a precursor are chemicals that are essential to the production of a controlled substance. So, tracking a precursor can provide us early insights into hotspots, what we like to call hotspots for illicit drug production. A parent compound, my understanding, is the overall drug and not its metabolite. But again, I am not a chemistry expert. But if this person would like to know more information, please feel free to email us at that email, and I can have one of our chemistry team provide you with some more details on that.
Fantastic. Thank you, Samantha. And some more questions here. So specifically around mass spectrometry that's used for analysis. So if you could provide a little bit more detail about what mass spectrometry is used for analysis and if there's one centralized laboratory for the analysis.
Yes, great question. I believe the if you're asking about the machine, we use a Waters QTOF machine. And again, I'm paraphrasing from our chemistry folks. And yes, there is a centralized lab. It is our internal lab, the Drug Analysis Services Laboratory, that a lot of our municipalities are also familiar with from their drug sample notification map. And actually, the drug analysis services data from those notifications are one of the data sources, excuse me, that get integrated into our drug watch.
Okay, fantastic. So I know earlier there was a question that Chelsea had asked that we had some folks more curious about understanding some of the communities that are involved. And I know you're saying because of privacy, you couldn't speak to which communities are represented. But are you able to speak to which provinces and territories that are part of this initiative?
Yes, I can give a bit of an overview, and again, if folks are interested, again, the both dashboards, the data is aggregated at the provincial and territorial level, so you can see which provinces and territories are currently participating. I will say that the dashboards have data up until July 2025 right now. So as we continue updating those dashboards, you'll see more and more, and we continue expanding the initiative, more and more provinces and territories, of course, will have data available for them. But right now, have data across 11 provinces and territories. And again, that might not be reflecting yet in the dashboard, but will be there in the next few updates.
Okay, wonderful. So I'm seeing lots of questions coming through, so this is actually quite exciting to see that there's a lot of interest. There's a question, I don't know if you'll be able to speak to it so much, because I know that if my understanding is correctly, that there are over 600 substances that you actually look at, but someone was curious to understand whether or not you can speak to the general substance categories that you analyze.
Sure. So I'm just gonna pull up quickly. Or Michaela, do you mind pulling up the slide? It was on the slide where we showed the report. We have, I think, about 7 or 8 categories total. Thank you so much, Michaela. So we have stimulants, opioids, hallucinogens, sedatives and hypnotics, antipsychotics, dissociatives, and precursors. So these are our pharmacological classes that we are currently looking at. And there may be others as, again, that list grows and may be made available on our dashboards and available, of course, to our collaborators.
Wonderful, thank you. We've got some questions here as well as communities are obviously quite interested in learning a little bit more. Are you able to speak to how much some of this analysis would cost, or what would the cost be for a community to participate in something like this?
Yeah, of course. I cannot give exactly the specific amount, but as I mentioned in the presentation, the the shipping and analysis costs are mostly incurred by Health Canada. The only cost that is not covered by Health Canada is the personnel needed that would have to go take the wastewater sample from the facility. But it is our understanding from working with other municipalities and facilities that a lot of this testing is done on a regular basis for quality control. So a lot of times we already leverage what is being currently sampled for with the wastewater treatment plant. So that would be the cost incurred by the municipality. And we do also cover the cost of the materials.
Okay, fantastic. So for a site or a community that would be interested in becoming a site, what would be the process or what would be the steps involved for them to participate in the initiative?
Yeah, I love this question. That makes me very excited. So I will share after, or we will share, I think, after this webinar, a small blurb with our email address, and you could just send an email to that, and then our team would be able to, schedule a meeting to discuss more of your interest as a municipality, and most municipalities will be considered based on existing infrastructure and with routine sample collection. And I'm not sure, Channi, if there's a way that we can share our email address with the participants at this point, but please
Absolutely.
let me know.
Yeah, no, absolutely. And I believe we have already shared it, but at the end of the slide, we'll make sure to circulate that as well. We do have some more questions coming through. One individual wants to learn a little bit more about the substances that have been identified and was curious to know if there have been any new psychoactive substances that have been identified as a result of the wastewater analysis that has been done.
Um, in term of new psychoactive substances, we have identified some of the more I call them news or media substances. I know that our team has identified xylazine in a number of samples. Again, I can't speak to exactly which ones have been identified, but there are a number of new psychoactive substances that are appearing in our collaborator samples that they were not previously aware of, or that they felt like they need to create a public health post in their community to advise people of the potential appearance.
Okay, thank you. And then another question that came through was more about data sharing. So this individual wants to know in terms of partners, if this data will be or can be shared with academic researchers or others who are interested in learning more.
Um, if the municipality, so as I mentioned, the municipality is free to do with the data as they wish. So if they're working with an academic institution and would like, or the academic institution would like to know more, and they are an active collaborator with us, then they can share that data with them. I hope that answers your question. In terms of an outside academic that would be requesting the data, unfortunately, they would not be able to get to the site specific level data, but they could have access to the publicly available data that's aggregated at the province and territory level.
Okay, great. And probably along the same lines as well, there's another question wondering whether or not the reports that come through to communities and municipalities, if they're also shared with local hospitals or other partners and agencies in a community.
Again, so it's really up to the municipality's discretion. So oftentimes when we onboard a municipality, we ask where they would like the reports to be or who the reports should be shared with. And we do have usually I think it's a maximum of 5 people that could be shared with. But again, once those 5 people have access to that report, they can then share it with whoever or their networks of other stakeholders or collaborators that they speak with.
Okay, thank you. And one last question I think that has come through here is specifically on the data itself. So I believe the surveillance looks at qualitative and data analysis. Is there interest or exploration being done to maybe look at qualitative analysis of substances in the wastewater?
We are doing qualitative, I think maybe
Sorry, I meant
quantitative. Yeah,
quantitative. Yeah.
quantitative.
Thanks,
Yeah,
Samantha.
yeah. I always get those two words are way too close in my opinion. We at this time, no, we are not looking at quantitative, but there is a possibility at a later point to expand into that quantitative analysis. But for right now, no, we are really focusing on that qualitative aspect. And really, the reason for this is because we're focusing again, like I mentioned at the beginning, on those unknown substances, and that really this a large screening panel really allows us to kind of better understand those unknown substances, and then at a later point decide which ones we should be focusing on to potentially quantify.
Okay, great. I think I have one last addition here. I've had someone just submit, and this will probably leave us to our last questions unless there are more that trickle through. But someone was hoping to get a little bit more detail about what the criteria or what kinds of resourcing, staffing, et cetera, that would be needed for a community if they were interested in participating in the initiative.
So again, it's really up to the municipality to when we discuss in terms of sampling requirements. So as I mentioned, our gold standard is is taking a sample 3 times per week, and then shipping those samples every 2 weeks. So it depends on really what the capacity of the municipality is. Is it if there's somebody already at the treatment plant or at the facility that is doing that kind of work and then can do this on the side, or if other personnel need to be hired. We've really had many different experiences, and it's usually the municipality that decides what kind of personnel they need um, to send those samples out.
Thanks so much, Samantha. And thank you, Chani, to my wonderful colleague for stepping in. You probably realized my internet just decided it was going to take a break before I was ready to. So I deeply sorry for that. But I know that they probably kept the conversation going beautifully. So thank you. And I just want to honor in the chat, we did get a really kind of a last minute question, kind of as Chani was wrapping up. And I just wanted to see if we had a comment for Sarah. So her question, so apologies if it's already been covered for folks, but if municipalities want to be engaged, can you talk through the pace of results and turnaround time and how real time that is? And I think you may have alluded to this in the presentation, but just as a reminder around that turnaround time.
Yeah, of course. And right now, that turnaround time is 6 to 8 weeks from the time that the sample is collected to when that report is given back to the communities. And again, we're really working hard on trying to build that internal capacity to make that shorter, that a little bit shorter. But for right now, we have to say that it is 6 to 8 weeks. And we understand that's why we always say, near real time data, hoping that, over time and having multiple reports accessible to that community that they can potentially see trends over time.
Okay. And actually, we do have one more just because we have you for the time, but we
I'm
got a
here.
question
Yeah.
around if there are intentions. So, you post provincial level data, but would there ever be a time when you might post regional level data?
For right now, I cannot say that we have a timeline for that or if that's a possibility. But in the future, if that were to become the case, if that is a decision that is made, all our collaborators would have to be notified and agree to that kind of level of granularity on the dashboards. Yes.
No, totally understand. All right, so I'm just going to share my screen again very quickly, and I'm just going to share a couple of QR codes for us. So if you want to share your thoughts around our webinar today, you can access this QR code. We use this data when we host all of our different learning events and webinars to find ways to improve in the future. So if you'd like to share any feedback with us, please do feel free to access the link through this QR code. So I'll just keep this up for about 5 more seconds for folks to access that. And then we also have a few upcoming webinars. So this is a series that we're hosting. And so if you're curious to know about our upcoming sessions, you can access the webpage through this QR code. And we would love to see you again if you're interested in joining. And of course, if you'd like to keep in touch or if you have specific questions for Samantha or myself and Chani through the Small Cities work, please do feel free to reach out. I'm going to keep this slide up as sort of our closing slide, so folks can jot this down if they'd like. But thank you all again for joining us. It was wonderful to see you. And before we say goodbye, I just do want to check and see if we've got any more questions before we wrap up. So I'm just going to stop sharing so that I can access my Zoom. All right. Okay, I'm just looking through here. So a couple more things that we did receive. Okay, so have we seen any of these results being tied to a local mental health or drug strategy?
That's a great question. So again, as I mentioned, our program is quite new, and as we continue to expand, we're learning more and more how our partners are potentially using this data. We do know that there are some communities and cities that are using it again for public health announcements, as well as potentially putting together I forget how they called it, but a strategic drug task force. But again, that's probably very early days. And wastewater really is meant to be that complementary data. So we always say that it could be used as a potential to further understand what is going on in their community.
So perhaps that's a call too. If anybody on this webinar right now is part of this surveillance program and would like to share how you may have used your results to inform your planning, please do reach out. I'm sure Samantha and her team would love to learn more about how that data is being used. I know as a knowledge broker, that's always what we're thinking about is how we're going to be able to move that into action, right? So really amazing source of data and incredible work that you and your team are doing. So grateful to the participants for all of your wonderful questions. And with that, perhaps we will say goodbye for today. And again, looking forward to hopefully seeing some of you at our next webinar in future. So thanks, everyone.
Thank you.